I already mentioned to some of my colleagues, I know that not everyone is from Finland, but from those from you who are from Finland, I have a very special feelings for Finland, because when I was a medical student, my first training ever abroad it was in Finland, in Oulu. And I went even to Rovaniemi in Taivalkoski, which is as far north as you can only imagine. So it's really a pleasure for me to be here. And I start with my disclosures. So the topics which I was asked to cover is antibiotics, infections, and allergies, a complex relationship. And I slightly change it by saying microbiota, antibiotics, infections, and allergies, and complex relationship. Because microbiota, of course, is a complex field with lots of ongoing research, and you have already heard about it, but also some widespread misconceptions. And I would like to refer to the paper which was published just a few days ago, Nature Microbiology. The title is Human Microbiome Myths and Misconceptions. There are 12 of them, and I will show them because some of them are those which I am repeating, saying again and again, and it's not true. Microbiome research is a new field. Well, not. For example, E. coli was identified in 1885, Bifidobacterium in 1889. So it's not so new a field. Joshua Lederberg coined the term microbiome. It was used much earlier. There are 10 to 12 bacterial cells per gram of human feces. The human microbiota weighs 1 to 2 kilograms. Well, there is no evidence to support that. There are no such measurements. The authors could not find it in the literature. The microbiota outnumbers the human cells by a ratio of 10 to 1. We repeat it again and again, but a few years ago there was already a paper, someone recounted it, and it's probably closer to 1 to 1, but still it's quite a lot. The microbiota is inherited from the mother at birth. Not exactly. Most of the expansion of the gut microbiota, the diversity occurs after birth, during the first years of life, and especially during starts after weaning. Most diseases are characterized by the pathobiome. Well, the authors are saying microorganisms and their metabolites are neither inherently good or bad, and their impacts on us as hosts is very dependent on the context. The firmicutes to bacteroides ratio is altered in obesity, as the authors are saying. In rodents, yes, but when it comes to humans, the data are not so clear-cut. The gut microbiome is functionally redundant, while there is some functional overlap in our gut bacteria. It's not entirely redundant. Some tasks rely on specific bacteria to get done. Sequencing is unbiased, definitely was the game changer. However, it's not without some issues which are related, for example, to collecting this and storing sample size, and as everyone knows. We need standardized methodologies. I have to say, I was repeating it again and again that we need standardized methodologies. It's not what the authors are saying. The effectiveness of a method can depend on the microbial community composition in a sample, which varies widely. So using diverse methods and verifying results through multiple approaches is preferable. And finally, most of the human microbiota is unculturable. Again, I think many of us were saying that the reason we have not grown all types yet is partly because we did not try hard enough before, not because it is impossible. Probably, of course, viruses, some of the fungi, it's definitely not. But for bacteria, apparently, we were not trying hard enough. Well, you may say, and the authors are saying, you may say it's very trivial, and indeed some of those points may seem trivial, but they argue that the accuracy of details such as this matters. If we are consistently repeating falsehoods about minor details, can our accuracy be relied upon when covering more important matters? So an important paper, Nature Microbiology, published online, but it's something which is really worth reading. And another paper which was published quite recently, there's a lot of debate about whether human fetus is sterile or not. And this is a paper, 46 experts, they are doing microbiota research, really like doing, not just reading about it and presenting, but really doing. And researchers refuted scientific claims that human fetuses harbor live bacteria. So the conclusion is a healthy human fetus is sterile. So I show, and the detection of microbiome in fetal issues comes mainly from the contamination. So I did share with you these two important recent publications because I think in the context of the discussions that we have today, these are important. But anyway, it's absolutely clear with all these discussions that the microbiota, gut microbiota is important, and especially during the first year, or the first few years of life. We are saying this 1,000 days, maybe 1,100, maybe 2,000, but anyway, early life is important. And there are many factors influencing, shaping the gut microbiota throughout the life. What is important for us, is of course what happens early in life, and we would like everything to go well, term delivery, vaginal delivery, breastfeeding, healthy environment, no drugs, no antibiotics, because we want to have something which is nicely called in this paper in Nature, security blanket. But as you know, everything can go wrong, or at least some of the factors. It may be preterm delivery, an infant may be born by C-section, no breastfeeding, an infant spends sometimes in NICU, gets antibiotics or other drugs which can contribute to so-called dysbiosis. Again, there is no agreement how to define it, but let's say there are alterations in the number and function of the gut microorganisms, but there is no agreement. And anyway, and there are associations between various diseases. But I will not discuss all of these factors. They are definitely important because the diseases are important, but I would like to focus on one of them, and these are antibiotics. Antibiotics which save life, there's no doubt, but I like this slide. Antibiotics are major disruptors of gut microbiota. And antibiotics are really overused. Look at these, 80% of all prescriptions during pregnancy, these are antibiotics. Up to 35% of women in Western countries are exposed to an antibiotic during pregnancy and delivery, and as this systematic review done by our Dutch colleagues shows, it has an impact on microbiota. You look at other countries, I mean in infants, not in pregnancy. Denmark, which is a country like you would say in your part of the world, you usually do not overprescribe antibiotics like in my part of the world. But still 23% respiratory tract infections, upper respiratory tract infections, and they get antibiotics. Data from United States, I will show you even more. New Zealand, 82% of children up to 2 years, they receive antibiotics. In another study, by the age of 4 years, 95% they receive antibiotics. Another study from US showing observational prospective cohort study, more than 14,500 children, of whom 70% received at least one antibiotic prescription during the first 2 years of life. And as you can see here, as association, not causation, but still an important study showing there's increased risk of various diseases. It might be for some diseases not exactly scientific, statistically significant, but it always there is an increase. It's not only the fact the antibiotic was given, the number, type, of timing of antibiotic prescription. This is something all that matters. And this is a take-home message from this part of my presentation, and it's also the title of another paper, Nature paper. But just by the way, look, 100 children receiving antibiotics, and only one of them, it was culture-proven early onset sepsis. So it shows you another study how this overuse of antibiotics, and the take-home message from this part of presentation is less is more. Why it's so important, I already mentioned, because there are these links, associations between those various factors and the risk of diseases, including dysregulated immune response and allergic diseases. This brings us to the topic of this symposium, gut microbiota and allergic diseases in children. There are many studies like this one,
And I would like just to highlight from the Nature Microbiology papers, microorganisms and their metabolites are neither good nor bad. They merely exist. Their impacts on us as hosts are heavily dependent on the context. So whatever we will see on those studies, what are the differences, what is increased, what is decreased, should be also discussed in the context. What are the main gut microbiota features in food allergy? I mean, many studies, many summaries, but if we want to put them together, what is really like that, you see it again and again, it's reduced diversity of microorganisms and reduced number of those short-chain fatty acid-producing bacteria. Not all of them, because there are differences, but definitely this is something which is very often. Dysbiosis, fewer butyrate acid-producing bacteria, fewer regulatory T cells, and it may lead to contribute to allergic diseases, to this imbalance between Th1, Th2 response. But this is all science. Patients do not care about our science. What they want to know is whether we can treat them or whether we can prevent diseases. And this brings me to the next part of my presentation, which are strategies to modulate the gut microbiota. Can we do something? Diet, of course, is a strong modulator, various biotic and microbiota transfer, or fecal or vaginal. Well, my talk is mainly about antibiotics. So you are probably aware of these claims, like probiotics can improve a perturbed microbiota, probiotics balance the microbiota, probiotics restore good microbes to a microbiota depleted by antibiotics, and many others. An important question is there solid evidence to support these claims? ISAP was already mentioned here, so I would just tell you that within the ISAP we do have this ISAP panel which works on the impact on probiotics, on antibiotics perturb microbiota composition or function, to see if there is any really good evidence to support all of these claims. It's still in preparation, a number of questions, so it's just for you to wait for the final word. But I can tell you the data are now not very strong to support this claim, just to summarize it even before the paper is finalized. But we are closer and closer to finalize it. Still, having said that, it doesn't mean that there is no role for these biotics, which Seppo already mentioned. Because if you look at various biotic supplemented formula, for example, you will see that some of them, there is reduction in the use of antibiotics. I mean, it was never a primary outcome, but in many of the studies with a reduction in the use of antibiotics, you will see. And I think that is extremely important finding. Again, I do regret it was never the primary outcome, so we really don't know what was the effect, because if there is reduction in this antibiotic use, of course, that perhaps we will have some effect also on other diseases. We don't have these studies, but it's something definitely which is important to study. Okay, another study which I think is important, does probiotic consumption reduces antibiotic utilization for common acute infections? A systematic review and meta-analysis which showed that probiotics provided to reduce the risk of for common acute infections may be associated with reduced antibiotic use in infants and children. So once again, probiotics altogether, so we have to look exactly which one, but it shows you that there is something behind it and something definitely worth considering. And this brings me to the next part of my presentation, which is not about microbiota and antibiotics, but infections and allergic diseases, also cow's milk allergy. So this is a topic together with my colleagues and also with Seppo, who is sitting here, and he was giving the presentation. So we published this expert opinion on early life respiratory infections in infants with cow's milk allergy. And at that time, our conclusion was, based on the evidence, the data on the CMA and infection risk in infants is limited. Hypoallergenic formulas may not support gut microbiota effectively. Select biotics could reduce infections and antibiotic use. Nutritional interventions potentially affect infections through microbiome modulation. It was in 2021. What is new? This was a study which was published more recently It's a retrospective study, more than almost 7,000 children, half of them with cow's milk allergy, observed for a mean period of 4.2 years. And cow's milk allergy led to more frequent multi-system symptoms and the need for hypoallergenic formula, and children with CMA had more recurrent infections. As you can see here, children had more frequent infections, all categories, and you can see this for all of them where there was a significant difference. So the study implies that CMA increases the clinical burden of children, requiring further research. There are, of course, study limitations. It was a retrospective study, data well sourced from electronic health records, possibly omitting crucial patient information. There is lack of breastfeeding data, which might confound group differences, and important, there is no distinction between symptoms before and after cow's milk allergy diagnosis. But anyway, there is such a study which looks at the infections and cow's milk allergy. But data generally are limited. And because the data are limited, and this comes from Espegan position paper, which was just published on the management of cow's milk allergy, then when we looked at risk of infectious diseases, our conclusion was there's insufficient evidence regarding a higher risk of infectious disease in infants with CMA. But it's really mainly based on this limited data. And this brings me also to the introduction of this Espegan paper. Christina West is one also of the co-author. Ivan van den Plas is the leading author. It took us probably more than 3 years to work and a lot of discussion. It's just published in the Journal of Pediatric Gastroenterology and Nutrition. It's an update of a 2012 position paper on CMA. It focuses on diagnosis, treatment, prevention with new insight on GI symptoms, includes updates on nutrition, growth, cost, quality of life, and includes 73 statements. It also includes those which were rejected, which is equally important, I think, to read those which we generally accepted. So please, if you are interested, I think you are, all of you. Otherwise, you would not be here. But we are also discussing biotics, and I would like you to have a look at the biotics and the risk of infections. I previously showed you various biotic supplemented formula and reduction in the risk of antibiotics. But if you look at the infections, again, you will see for prebiotics, probiotics, symbiotics, postbiotics, there's reduced risk for GI or respiratory tract infections. So something, and you will hear more from Christina West, that something is which is worth studying. So my take-home messages are early life antibiotics can disrupt gut microbiota and increase allergy, including food allergy risk. Research is needed to determine whether correcting dysbiosis can prevent or treat allergies. There is insufficient evidence regarding a higher risk of infectious disease in infants with cow's milk allergy. Biotic formulas can reduce antibiotic use and infection risk, but each biotic, and it's extremely important, should be evaluated individually. And my final slide is, if you have any questions, please keep it for yourself. I am not Google, and I am not ChatGPT. Thank you very much.